Pro Group Management, workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, we're talking death with dignity with Assemblyman Joe Dalia of District 29. Here for the whole show on an all-new Nevada Newsmakers.
What is that?
That's the governor's funding bill for education.
It looks pretty flat. Wasn't there a plan to increase funding for our schools?
Yeah, but the governor's ignoring it.
We have to pass the plan.
When in Carson City, Nevada Newsmakers records in the conference room of the Nevada Builders Alliance. Coverage of the 2025 legislative session is brought to you by Pro Group Management, workers' comp that works for you. NV Energy, proudly serving Nevada, providing electricity to 2.4 million electric customers. The Retail Association of Nevada, looking out for business. And by Story County, helping build Nevada's future.
The trucking industry is the most resilient link in the supply chain, moving 95% of our freight in the Silver State. And while essential, the road isn't always smooth. Supply chain disruptions, rising fuel costs, and unrealistic rules and laws that hamper our ability to serve our customers and country. Our prosperity and every sector of the economy, manufacturing, mining, medicine, and food from farm to table, is tied to trucks. There's nothing without trucking.
A power line is more than a power line. It's maintaining the bottom line for small businesses. It's keeping the assembly line moving for our workforce. For our brightest minds, it's meeting a deadline. It's on the front line with our heroes. And on the sidelines of the biggest games. It's a direct line to our loved ones. And it's a lifeline for the most vulnerable. There's a lot on the line.
This state does some things even my sixth graders wonder about.
Like commissioning a study and spending thousands of hours finding out how much our schools need.
Then the governor ignores it.
And says kids get $2.
That's $2 Joe.
My students would say pass the plan.
Yeah, pass the plan.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, coming to you from Carson City, here from the home of the Nevada Builders Alliance. We are delighted to welcome to the program again Joe Dalia. He's a first-term Democrat from District 29 in Henderson. He serves on Health and Human Services, Education, and Judiciary. He's a University of Michigan Law School grad. Pleasure to have you on the program.
Pleasure to be here. Thank you for having me.
So, for the last several sessions, ever since it first came up, the whole Death with Dignity bill has been something that I have been very supportive of. I'm somebody that believes that we all have the right for our own destiny, and this and other issues like abortion, that it is the individual's right, not the group right. You have been furthering this bill. The governor comes out and says, forget it, I'm going to veto it anyway. And despite that, the legislature has said this is going to keep going. So first of all, were you shocked when both of those things happened?
I mean, you never want to find out the fate of your bill on social media. I think that's a very 2025 result. But I was a little surprised by the timing of it, because I think, with so much of session left, I thought, maybe we could still have that conversation continue. And I think it's incumbent upon me. I think when we decided to continue moving it forward after that, the decision was really, we owe it to people who are going to be affected by this law to give them every opportunity for this to get through. And you don't want to see momentum stunted either, right? Because this is a bill that made it all the way to the governor's desk last session, which was the furthest that it ever made it at that point. And now we've got the new honor of, we have 3 Republicans that supported it in the assembly. That's a new record, right? And I think that switch to a bipartisan piece of legislation, it was really important for me to have Danielle Gallant as a co-sponsor in the beginning, because they really hammered home that this is something that crosses party lines. And when you see the
she had been against it.
She had been against it, right? And I think, I believe Assemblyman Gurr, my apologies, Burt, he had, I believe, voted against it last session. So, we're seeing some development there and some momentum towards making this something that isn't going to be viewed in those red versus blue terms. But I wasn't surprised by the vote total because I know in private conversations we'd had, folks are supportive of this, right? And I think as we continue this forward, we might see momentum continue to build, but it's about having those conversations with the governor's team to make sure this is getting closer to a place where he can feel comfortable signing it.
Do you think that his thought is based on the religious perspective? Because I know that Joe Hardy, when he was in the legislature, now of course mayor of Boulder City, as a doctor, his line to me, and I love Joe Hardy, he's the nicest guy. We disagree on lots of things, but he's a super nice guy. And he said the first rule of being a doctor is do no harm. And he and I would debate that point, over and over the years. But it just seems to me that, as individuals, we have abilities to do things. It comes down to how do we do those. But before we even get to that, if you don't mind, you gave a really passionate speech in the Assembly. Would you share with this audience, because that's such a small audience by comparison with the audience that a program like this has. Right. Would you share your story?
Yeah, I'm happy to. I don't want to put everybody through the rehash, but my dad was someone who was affected by this, and he had end-stage COPD, which is essentially where your lungs stop working, right? So he would have these coughing fits where he couldn't really clear his lungs. And at the end, they basically told him, he got hospitalized. We weren't sure if we were going to get him out of the hospital. And we were told, if we get you out, you're going to have weeks to months. It's going to be miserable. You're going to have every coughing fit. You're going to question it and wonder if that's the last one you're ever going to have, right? Because they basically said at some point you're going to start coughing. And unlike the other coughing fits you've had for months, this one's not going to stop. You're never going to be able to clear the fluid from your lungs. It's going to get worse. It's going to accelerate. And so he heard that and he was like, I'll take any other type of death. Can we take guillotine? Can I take a car accident? No. He actually talked like that. He was a huge personality. But he was terrified of this, and his first thought was, is medical aid and dying legal in the state? And once that was clearly not the case, we were like, can we get him somewhere? This is probably a situation that would apply to a lot of patients in his position. We couldn't get him on a plane because he was on oxygen. The plane's not going to take off. And if we drove him, the ways to get to the states where it's legal on the road, a lot of stretches in the middle of the desert, right? We were told if there's a medical emergency, right? Like if something happens with his oxygen, some other thing happens, and he dies out there because you drove him into a place that's kind of a medical desert, that's on you guys. You could have some criminal liability for that.
Really?
Yeah. And I don't know that would have held up. I don't know that a prosecutor actually would have pursued that. But just that being planted in my dad's head, he was like, I'm not willing to take that risk with my family. This was about a personal autonomy thing for him. He wanted to make that call for himself, but he didn't want any of us to deal with consequences because it's like he wanted to do. So he stayed put. He talked to the hospice nurse, told her how worried he was about it, and said, look, I don't want to go like that. Is there anything you guys can do to make it easier? And they said, advanced pain, almost exactly what the veto message said last session and what the tweet said this session. Advanced pain management and palliative care have advanced so far that you're going to be fine. When the day comes and that coughing fit continues, call me up. We'll get you some morphine. We'll get you some Ativan. You're going to smoothly go into the night. We got to that day. That's obviously not how it went. It was a really, really rough way to see him go because he was afraid and struggling the entire time. He was conscious, couldn't talk because of the breathing, but you could tell through his eyes and how he was non-verbally communicating with us that he was aware of what was happening. And when he did get some words out, he said, she lied, she promised, this effing sucks. And I think that just underscores how, in a state that values personal autonomy so intensely, for my dad to have this death sentence thrust upon him, this horrible death sentence that he then has to live out in slow motion, it was wrong. And I think that personal experience is a big part of why I was willing to bring this piece of legislation, because I know, Senator Parks, Senator Flores had done a good job championing this issue before my time. And, when I was first approached about this bill, that seemed like a no-brainer for me to continue this fight. And I knew when we were walking into it that the odds were going to be long, but I just think about my dad and I think about the patients like him that are suffering, some of whom have reached out and indicated that they really hope this passes so that they could take advantage of it. I think about this is the only bill where if I don't get this passed, folks are going to die badly for the next 2 years. A lot of pressure to put on myself, but also feel like my co-sponsor and I are just aware of the gravity of it, right? And we know that this is a bill that's going to impact a lot of people, and it's going to impact in the most intense way that a bill can impact a person. So,
well, thank you for sharing that story. I'm sure that it's not easy to retell that story and relive that. It just seems to me that, we, as you said, we value personal liberty so much, not just in this state, but in this country. And we do certain things that are the opposite of this. For example, we don't have a problem with executing people who are criminals.
right.
Okay.
Right.
It's like it's not anybody else's business, and in this case, it's mine.
Right.
Because, thankfully, at this point in time, I am healthy. There are no issues that I'm suffering from.
Right.
But if something were to happen, I have choices.
Right.
So, if I'm not allowed by the state to medically take care of myself, then and I mean to forward my passing, my death.
Right.
There are ways I can do it. I can turn on the gas at the house.
Right.
And put my head in the fireplace and be gone. I can go into the garage and turn on the car with the garage door closed and be gone. I can put my head on the railroad tracks but my thought is that every one of those instances is a horrible solution for the emergency medical people who would show up and have to deal with that.
Right.
For the train driver who would have to deal with that. I mean,
Your family. Right.
Obviously, yes.
Yeah.
Even more. So the ability to do something about this, that's my choice. Now I understand that there are all kinds of things that people throw up, religious, legal. That they're going to figure out a way for you to benefit from you dying quicker. So therefore, the medical industry would be in favor of it because they would, and it's all nonsense because we can legislate that.
Right.
Right? We can legally go. We have legalized marijuana in the state that 40 years ago, was not going to happen. It just seems to me that I can do all of those things. I can even, buy a chainsaw and do it that way.
Right.
But why can I not do it in a way that makes sense, that spares my family from all those problems? And and I'm sad that your dad had to go through this, but the governor mentioned palliative care.
Right.
And it's like, no, it's not your decision, and I have no problem with the governor. I like the governor, and I think he's doing a good job. But in this particular issue, I don't know what the pressures are on him, whether from the religious community, because obviously the Catholic community, at least in its leadership, is against it.
Right.
The leaders of the church, and also the Mormons around the state put together an ad in the newspapers, the Reno Gazette Journal, Las Vegas Review Journal, probably other places as well. It's none of their business.
Right.
I'm sorry, it's none of their business. And I respect everybody's religion, but it's their religion, and for them to do what they want to do with their religion, I have no problem with that.
Right.
But
it's an exercise of personal autonomy.
But it's nothing to do with me. It's my body. I want to be able to have control over this ultimate situation. And I'd like it, if it's okay with everybody else, to do it in a manner where I don't go through a horrible death as your father had to suffer through. That to me is just beyond sense.
I know it seems like a no-brainer, and I mean, again, when you look at the public numbers, it is so disproportionate. Like, you don't see a lot of issues that are 70-30, and that this is a 70-30 issue. It just happens to be the case that 30 is intensely opposed, right? And they are so loud about it. And you have a lot of folks who are in favor of it, for whom there's a deeply personal experience that they're thinking back to, maybe a traumatic experience, like, in my case, where it's, I had to watch my dad, my hero, reduced to that, right? That's my lasting memory of him, is that that version of him. And so it's hard for folks in that position to step up and meet the zeal of the small but very loud opposition. So, but I agree with you, and I think all we have to go on in terms of the governor's position is that stated message. So he's
and by the way, he carries a gun.
Right.
Okay, and as
Right.
a law enforcement officer, and I don't know whether he's ever had to draw that gun, but he certainly has been trained to do that, and if necessary to shoot and to shoot to kill. Because if you pull your weapon, you don't pull it to wound somebody.
Right.
And so I don't understand the two sides unless it's based on religion. And if it is based on religion, great. Let it be your personal decision. You don't do it.
Yeah.
You don't allow your family, whatever.
Right.
But leave me alone. Because to me, it's a very personal issue. Because I look at, the cost of end-of-life care.
Yeah.
Is insane.
It is, and I mean, but that is one of those arguments that ends up being manipulated, where folks are like, "Oh yeah, the end-of-life care is so expensive that they're going to pressure you into putting down grandma." Right? That's why we put in so many safeguards to make sure this is your call, right? And we go to great lengths to make sure that you're requesting this medication twice orally, once in writing. There is a standard to make sure you're not being coerced and that you're of sound mind and can make that call. So I agree. I think this is an issue of personal autonomy, and we shouldn't be forcing that decision on anybody else.
All right, let's take a break. We'll come back. We have other issues to talk about. But I thank you for what you're doing. I know it's not easy when you have that kind of opposition, but let's take a break and we'll be right back.
Meet Nevada Health Link, Nevada's official health insurance marketplace. Your link to savings, selection, free assistance, and name brand health insurance, where 90% of enrollees lower the cost of their monthly premium. Everyone deserves access to quality health coverage, no matter your income or family size. Visit NevadaHealthLink.com. A few minutes could save you hundreds of dollars per month.
Nevada Health Link. Our plans are made for your plans.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Joe Dalia. He's a first-term Democrat from District 29 in Henderson. You're on Health and Human Services.
Correct.
We're still looking at the potential for cuts in Medicaid. And we've got the Economic Forum coming out in a couple of days with their numbers. There have been enough leaks that it doesn't look rosy. What are your thoughts? I mean, does this just completely blow up the state budget?
It doesn't look good. I just know the public information, so I don't have any inside intel on that. But from what we've seen, this does not look like it's going to be a good report. I think we're going to end up in a situation where we're going to have to look at some serious cuts. And I think it was really helpful that we had that joint session with Senate Health and Human Services and Assembly Health and Human Services to kind of talk through what that might look like.
And how does it look?
It looks pretty bleak. I mean, I think we're talking about cutting essential services. We're talking about half of kids in Nevada could lose health care.
Literally?
Literally, 1 in 2. And then A lot of services in rural areas in particular are going to need to be cut. I think there was, if memory serves, there were conversations about a psychiatric facility that was kind of the only option for folks in a pretty large radius. That would need to be cut from a hospital because that's mostly funded through Medicaid patients. So it's not a good situation. I'm hopeful we're not put in that position because I don't think our budget is built for this level of federal government chaos. We've kind of trusted that for a long time there'd be a steady hand at the wheel in Washington, and whatever circumstances might hit us, like maybe we run into a recession and we have to do normal cuts. This is a completely self-inflicted situation that goes beyond the pale of anything we've seen. So I'm hopeful that the report doesn't turn out as bad as some of the public numbers have indicated they might be, but I don't think it doesn't benefit us to prepare for the best. It benefits us to prepare for the worst. So,
well, Dr. Titus, the Senate Minority Leader, has said that we have other monies that could be put towards this, and then at the same time you're looking at the movie industry, looking for these giant tax breaks to be able to put in these movie studios. How do you balance those two out?
Well, I think there still needs to be an ongoing conversation about economic development, because that's something that over the course of, when I was in high school, we were talking about how badly the state needed to diversify its economy, right? We're still having that conversation because we haven't made the kind of inroads that we wanted to make over those 2 decades. And so when we haven't...
But hang on, let's look at reality here.
Sure.
Which is, you have the gaming/entertainment industry. It's massive. You can do bits and pieces to diversify away from it. But unlike Northern Nevada, where you have a limited amount of gaming, successful, but limited amount of gaming, a place like the Tahoe Reno Industrial Center, now Fernley, have been able to do remarkable things in terms of diversifying the economy. But the idea that you can diversify away from the entertainment industry in terms of gaming.
Yeah, I mean, I do think that in this limited circumstance, this is a uniquely nice complement to our gaming industry and our entertainment industry, because Hollywood and Las Vegas have always kind of had this relationship over time, and like a lot of people come here to shoot movies already. I think to the extent that we have films in particular that take advantage of our skyline and that promote our city and our state, that could be a really unique vertical integration that helps the state in a way that maybe other states can't advertise themselves, because we could see something like the Hangover effect, right? Where someone sees a depiction of the crazy nights you can have in Las Vegas, right? And then suddenly we see a spike in tourism from that. I don't necessarily condone a bunch of Hangover knockoffs being made, but if we had a bunch of movies come out that, like a new spike in movies coming out that depict Las Vegas and that kind of like put us front of mind for folks when they're deciding where to spend their vacation dollars, I think that could be a helpful complement to what we already have.
All right, let's take another break and we'll be right back.
Welcome to Story County, where history meets innovation, and a pioneering spirit continues to shape our future. At the heart of the Tahoe Reno Industrial Center, we power the future with global leaders in technology and manufacturing, driving progress that reaches far beyond our county lines. From advanced manufacturing to tech innovation, our industries are creating thousands of quality careers, fueling a vibrant economy that benefits every Nevadan. But it's more than just growth. Our community is our foundation, supporting families, empowering local initiatives, and creating a place where everyone belongs. Be part of a legacy built on bold ideas and boundless possibilities. Join us in building a brighter future right here in Story County. Story County, helping build Nevada's future.
Your good times are at Tamarack Casino during the $150,000 Denim and Diamonds giveaways, with cash and free play drawings every Thursday and Saturday, and $30,000 in grand finale giveaways Saturday, May 31st, including a top prize of $20,000 guaranteed. Your good times are at Tamarack Casino.
Save money and take transit. Did you know you can ride the bus all day for less than what it would cost you for a gallon of gas? Plan your trip now by going to rtcwashoe.com.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Joe Dalia. He's the first-term Democrat from District 29 in Henderson. You were an intern for Harry Reid.
That's right.
What did you learn from him?
You know, the number one thing was the passion for public service. No matter, because when I met him, he was very far along in his career, and even at that juncture of his life, he was still so committed to helping our state and giving us a platform on the national stage. And, to see someone who can go through and be in this game for decades and decades and decades and still have that passion was so inspiring for me as someone who was told, at 19 years old or 20 or whenever I was interning for him, that like, oh, this game, you're going to get cynical in a couple of years, you're going to burn out. And to see him be there and go through everything he'd gone through and still be at that level of passion really inspired me.
And that's where we have to leave it. Thank you so much for doing this. Thank you for what you're doing at the legislature, and the best of luck with it.
Thank you, Sam.
And we'll be right back.
Each day, the Children's Advocacy Alliance partners with leaders, legislators, and families across Nevada to improve children's health, education, economic well-being, and safety. We recognize Nevada will be no better than the state of its children. Be a part of this change. Be a supporter of the Children's Advocacy Alliance. For more information, go to caanv.org.
We don't have a choice where we go to school, even if it's unsafe or we're being bullied. It's not fair. Every family should be able to choose the school that is best for us, not just the families who have a lot of money. Governor Lombardo wants to give every kid and every family the ability to go to a school where we can learn and where we're safe. He's fighting for us. Thank you, Governor Lombardo.
Carson Valley Inn, it's your place for the good times. Carson Valley Inn.
When in Carson City, Nevada Newsmakers records in the conference room of the Nevada Builders Alliance. Coverage of the 2025 legislative session is brought to you by Pro Group Management, workers' comp that works for you. NV Energy, proudly serving Nevada, providing electricity to 2.4 million electric customers. The Retail Association of Nevada, looking out for business. And by Story County, helping build Nevada's future.
Thanks for watching Nevada Newsmakers, come to you from Carson City, from the headquarters of the Nevada Builders Alliance. We'll see you on the next broadcast. Thanks for watching.